Good afternoon for everyone. Thank you for joining us. My name is Vyacheslav Getmantsev, and I'm a software developer in IMC. I'm excited to share with you some innovative ideas on how we can revolutionize smart healthcare using personal virtual assistants or PVAs, like we name it, in combination with swarms of Internet of Things device. Our focus will be on enhancing care for the elderly, a demographic that are rapidly growing and presents unique challenges and opportunities in the healthcare sector. Before we dive into the details, I'd like to set the stage by highlighting the presenting need for advanced healthcare solution tailored to our aging population. We will explore how technology can bridge gaps in current care models, improve patient outcomes, and empower elderly individuals to take an active role in their health management. Now, let's begin by outlining what we'll cover today. Here's an outline of what we will cover today. We will start by discussing the aging population of the European Union and the challenges that came with it. Then we will delve into how IoT swarms and PVAs can address these challenges. We'll also look at the systems implementation, synthetic data generation for virtual patients, and conclude with interactive discussion. Let's begin by examining the demographic trends that are shaping the future of the healthcare. The European Union is experiencing a significant demographical shift. In 2018, over 101 million people were aged 65 and older. As of this year, they make up more than 20% of the population. By 2050, this number is projected to rise to nearly 130 million, according to almost 30% of the total population. With this context in mind, let's examine that specific challenges faced in elderly care today. The demographic shift towards an older population present several significant changes in elderly care. Firstly, there is an increased demand for long-term care facilities and home-based services, which sustain existing healthcare infrastructure. Secondly, elderly individuals often require a holistic approach to care that integrates medical treatment with personal and social support. Coordinating among healthcare providers, caregivers, family members, and social services becomes vital. Personalized care plans are essential because older adults have diverse health conditions, preferences, and social circumstances. A one-size-fits-all approach is insufficient. Care must be tailored to meet individual needs. However, current monitoring system often lack real-time data integration, make it difficult to respond promptly to the health changes. There is also a lack of personalization and adaptability leading to suboptimal care and reduced patient engagement. These challenges underscore the necessity of innovative solutions that provide real-time, personalized and integrated care. Personal virtual assistants and swarm of Internet of Things device technologies that immense potential to transform elderly care. PVAs are intelligent software agents capable of interacting with users and devices to perform tasks, provide information, and facilitate circumcision. When integrated with swarms of IoT devices, a network of interconnected sensors and gadgets, PVAs can significantly enhance functionality and user perception. This synergy allows elderly individuals to engage more actively in their own care, promoting autonomy and empowerment. The combined system enables real-time monitoring of various health and environmental parameters. Advanced analytics process the data to provide insights, detect anomalies, and predict potential health issues before they escalate. Let's delve deeper into the composition of the IoT swarms and their role in continuous health monitoring. The IoT swarm comprises a diversity array of devices, each contributing unique data and capabilities. Wearables like smartwatches or fitness trackers monitor activity levels, heart rate, and sleep patterns. Medical devices like blood pressure monitors, glucose monitors, and weight scales provide critical metrics for managing chronic conditions. Advanced devices such as ECG, it's an electrocardiogram, and EEG, it's electroencephalogram monitors, offers insights into heart and brain activity. Smart beds can track sleep quality and detect movement patterns, while smart pills bottles, like this one with pills, can ensure medication adherence by tracking them medication are taken. These heterogeneous devices work together to provide comprehensive, continuous monitoring of vital signs and health indicators. Beyond personal devices, environmental sensors also play a crucial role. The system includes both indoor and personal IoT swarms. Indoor swarms monitor environmental factors like temperature, air quality, smoke detection. Personal swarm focus on wearable health devices, mobility aids, and even smart clothing to track individual health metrics. Let's discuss how the collected data is analyzed and utilized. These swarms collect vast amount of health data, which can be analyzed to identify patterns and anomalies indicative of emerging health issues. Environmental data adds context, helping correlate environmental factors with health conditions. Real-time integration of this data is crucial for timely interventions. Central to this system are the health knowledge base models utilize the PVAs. The personal virtual assistant utilize health knowledge base models to analyze the incoming multivariative data. It identifies anomalies, patterns, and outfills that could indicate health problems. These models continuously learn and improve as more data becomes available, supporting increasingly personalized healthcare. Let's see how the system responds to these insights through swarm actuation and alerts. Swarm actuation refers to the system ability to automatically trigger approaching action based on the synthesized analytics. This could be mean sending emergency alerts, notifying caregivers of critical changes, or monitoring the spread of infection diseases to enhance response times. Now let's explore the specific roles played by PVA nodes with the system. PVA nodes play several roles. They collect measurements from both indoor and personal IoT swarms. They perform real-time integration and calculation of biomarkers and some indicators. This helps in assessing health status, compliance with care plans, and evaluating homeostasis for individuals and groups. Let's look at how the system addresses critical situations that may arise. Personal virtual assistant can address critical situations such as detecting falls, monitoring rapid changes in vital signs, managing chronic illness, assessing stress and anxiety levels, and tracking sleep quality. Early detection of these issues can significantly improve outcomes. Now, let's discuss the overall system approach and the whole structure. The system employs services that receive continuous data streams from IoT swarm. These services calculate biomarkers and health indicators, transforming raw data into meaningful metrics. The knowledge base accesses these indicators within the context of each individual health status and history by evaluating health homeostasis and compliance with care plans. The system identifies deviation requiring attention and initiate appropriate actions. Let's examine the features of the swarm nodes facilitating this operation. Swarm nodes are designed to interoperability, accommodating various devices and sensors. They are heterogeneous, meaning they can have different roles and capabilities based on their innate or programmed skills. PVA intelligence transforms raw data into high-level information for decision making. Understanding the objectives of this Internet of Things swarms will further clarify their importance. The primary objectives of personal and indoor IoT swarms are to provide specific health measurements required for biomarkers calculation, monitor overall health and well-being indicators, ensure compliance with care facility regulation, and enhance data-driven decision-making process. And now we will discuss how the system is implemented in long-term care facilities. In the long-time care facilities, each resident is equipped with a personal IoT swarm. Operating on a swarm as a service model allows for scalability and flexibility. The personal swarm interacts with indoor sensor and the PVA swarm, collecting data, sending measurements, and receiving event notification. This integration ensures comprehensive monitoring and timely responses. Let's take a look at the software stack. The system uses as a core the Pharos Navigator platform for modeling and rapid development, MQTT protocol for facilitate efficient data transmission. We integrate stable open source components like operating system, Node.js and Poco C++ as a server-side scripting, Apache Kafka for messaging, PostgreSQL for database solutions, and Docker with Kubernetes enables scalable deployment and management across clusters. To validate and refine our system, we utilize synthetic data generation. To test and refine the system, we generate synthetic data for a large group of virtual patients. Each virtual patient has an unique profile and attributes, allowing us to simulate various of conditions, behaviors, and outcomes in a controlled environment. Let's discuss the specific attributes assigned to these virtual patients. We assign comprehensive attributes to virtual patients, including demographic information and vital signs. Calculated metrics like body mass index, but not only this one, help to assess health status. This allows us to simulate a wide range of health scenarios, from healthy individuals to those with chronic conditions. Understanding the importance of the BMI is crucial. Let's explore this metric further. BMI is a crucial metric for assessing whether the individual has a healthy weight relative to its height. It helps identify potential health risks associated with underweight or overweight conditions. We use the standard formula to calculate BMI for each virtual patient. And considering real-world data correlation is important when we generate synthetic data. That's why in real-world data, certain dependencies and correlation naturally occur. For example, older patients are more likely to have chronic conditions. Similarly, weight can affect vital signs like blood pressure and heart rate. Recognizing these correlations helps in generating realistic synthetic data and setting personalized reference ranges. Now we will explore how weight specifically affects vital signs. Obesity can significantly impact on vital signs. Obese individuals often have an elevated blood pressure, higher resting heart rates, and increased respiratory rates due to the additional work of breathing. They are also at higher risk for conditions like sleep apnea, which can affect oxygen saturation level, especially during sleep. Understanding interdependencies between vital signs is also crucial. Vital signs don't exist in isolation. They can influence each other. For instance, a fever can lead to an increased heart rate. Stress or anxiety can elevate blood pressure, like in me for now. Understanding these interdependencies is crucial for accurate health assessment and timely interventions. Ensuring data validity is fundamental when generating synthetic data. When we generating synthetic data, it's essential to ensure that the data is valid and realistic. We avoid impossible values like negative ages or out of range vital signs by implementing validity checks. Maintaining data integrity enhances the reliability of simulation and the robustness of the system. Defining threshold for critical condition is essential for timely intervention. Understanding this threshold at which vital signs indicate critical condition is vital. For example, if resting heart rate from patient is below 50 beats per minute and higher than the 100 beats per minute, it may indicate serious cardiac issues. Defining this threshold helps the personal virtual assistant system alerts caregivers promptly, ensuring timely interventions. Addressing the challenge of nighttime monitoring is also very important. The most dangerous time for missing abnormalities in vital signs is at night. Studies how that the vital signs are taken less frequently during these hours. PVAs fill this gap by providing continuous real-time monitoring through the night, enhancing patient safety and ensuring prompt responses. Now, let's engage in interactive discussion to explore additional ideas. Let's have an interactive discussion. What are the measurements of, or maybe some data points could we include to enhance patient care? Think beyond standard vital signs, perhaps mental health indicators, social engagement metrics, or nutrition intake tracking. Your insights are valuable in expanding the system capabilities.